Google breast implants and up pops loads of articles. Celebrities rocking breast implants with pride, or speaking of horrifying regret. Still, while many have had them removed,
this is by far the #1 most common procedure done by plastic surgeons in the U.S.
Board-certified plastic surgeon Dr. Shaher Khan says breast augmentation is a ginormous moneymaker.
It's not uncommon for someone to do 20,000 implants in their lifetime.
At an average of $7,000 a pair, multiply that by 20,000 surgeries for every plastic surgeon doing augmentation.
That's a lot of money.
$140 million. And I have never augmented in my career because when I was a med student at Yale, I saw the adverse effects.
The FDA banned augmentation in 1992 when silicone was causing some women to get sick and lawsuits were filed. But that ban was lifted 15 years later and silicone implants eventually returned to the market.
Now we're seeing what is a reemergence of the same set of problems, history essentially repeating itself.
He's referring to breast implant illness caused by silicone leaking into the body. Dr. Khan says the shell of all implants are made of silicone, and he says none are safe.
Every time I look at a capsule under the microscope, I see all is inflammation.
Dr. Khan says breast implant illness is linked to breathing issues, chest pain, throat ailments, neck and back pain. One expert concluded
that silicone traveled in the blood and then embedded within the lung.
I got a chance to go inside Dr. Khan's operating room. Dr. Khan is among a dozen board-certified plastic surgeons in Michigan doing explant surgery. He painstakingly removes these implants and the shell, like this one, that forms around the implant in a woman's body. It's a 3 to 7 hour surgery. What's the worst you've discovered linked to this?
So I've seen mold, I have seen infection, I have seen inflammation.
We watched as this woman underwent explant surgery after having her implants for 20 years.
10 years ago, I noticed a lot of changes and started doing more research and found out it could be, a lot of my symptoms could be due to my implants.
Do you have a daughter?
I do.
What would you tell her?
No way.
Tracy Geary had explant surgery 3 years ago in Costa Rica. How do you feel now? You're 3 years out.
Oh my gosh, I feel like a completely different person. I completely got my health and my life back.
Today, there are more than 140,000 women, all sharing similar horror stories. Board-certified plastic surgeon Dr. Amy DeRosa stopped doing breast augmentations 2 years ago after removing implants from a woman who said she was ill.
A week later, she comes into the office and she's brighter than ever and telling me that all these symptoms so far are starting to resolve on their own one by one.
The rupture risk from implants goes up after 10 years, but many women were never told these are not permanent.
Every 3 years, you're supposed to get an MRI for silent ruptures. Most people don't know that.
Now the push is on in Michigan for a mandatory informed consent, spelling out all risks.
We're not trying to ban implants. I'm just trying to get a warning for people.
The FDA should step up and say, let's put a halt, let's figure this out before we harm any other patient.